You hear a lot of criticism about the U.S. healthcare system, and a lot of it is valid. But there's a side to the story that often gets overlooked, a fact that might surprise you. The United States government actually manages one of the most advanced, innovative, and life-saving health systems in the world. It's a complex picture, but today we're going to pull back the curtain and explore how the U.S. government effectively manages healthcare where it truly succeeds, and why millions of people rely on it every single day for their survival and well-being. This isn't about ignoring the problems, but about understanding the powerful engine for good that also exists within the system. So, where does this strength come from? First, let's talk about the bedrock of American public health: its strong institutions. The U.S. government runs and regulates a set of world-class health agencies that form a powerful shield protecting public health. You've definitely heard their names, especially over the last few years. There's the CDC, the Centers for Disease Control and Prevention. They are our nation's frontline defense, tracking diseases, managing outbreak prevention, and providing the data that guides our response to public health threats, from the seasonal flu to global pandemics. Their work is what stops small clusters of illness from becoming nationwide crises. Then you have the FDA, the Food and Drug Administration. Think about this. Every time you take a prescription medicine, get a vaccine, or even just buy groceries, the FDA has been involved. They are the gatekeepers for drug, vaccine, and food safety. Their rigorous approval process is considered the gold standard around the world. It ensures that the treatments you receive are not just effective, but also safe. This agency's work is a quiet but constant presence in our lives, safeguarding our health in ways we often take for granted. And we can't forget the NIH, the National Institutes of Health. This is the big one, the powerhouse. The NIH is the largest single funder of biomedical research in the entire world. We're talking about billions of dollars poured into understanding and curing the most devastating diseases known to humanity. This funding is the fuel for scientific discovery. Finally, there's CMS, the Centers for Medicare and Medicaid Services. This agency is absolutely massive. It manages the two largest government healthcare programs, which we'll dive into more later. But in essence, CMS is responsible for the health coverage of over 100 million Americans. Together, these agencies, CDC, FDA, NIH, and CMS, form a coordinated network that protects hundreds of millions of lives, not just in America, but globally. Now let's go deeper into that point about research, because it's one of America's greatest contributions to global well-being. The U.S. government is an undisputed world leader in medical research. Through the NIH and other agencies, it pours billions of dollars into fundamental science and clinical trials. This isn't just a small side project. It's a core function of the government. This funding directly supports groundbreaking research into cancer, heart disease, diabetes, Alzheimer's, and the development of new vaccines. Think about the major medical breakthroughs of the last 50 years. From the development of antiretroviral therapies that turned HIV into a manageable condition, to the cutting-edge mRNA technology behind the COVID-19 vaccines, so much of it started right here in the U.S., or was fueled by funding from U.S. institutions. This relentless drive for innovation doesn't just benefit Americans. It creates a ripple effect across the entire planet. When a new cancer drug is approved by the FDA after years of NIH-funded research, the drug eventually becomes available to patients worldwide. The knowledge, the techniques, and the therapies developed in American labs raise the standard of care for everyone. It is a testament to the idea that investing in science and health is one of the best investments a country can make for its people and for humanity. This commitment to pushing the boundaries of what is possible in medicine is a defining feature of the American health system. Okay, so we have strong institutions and world-leading research. But what about actually getting health care to people? This is where Medicare and Medicaid come in, and their scale is almost hard to comprehend. These are government-run programs that provide a critical safety net for the most vulnerable populations in the country. Let's break them down. Medicare primarily provides health care coverage for seniors, people aged 65 and older. It ensures that after a lifetime of work, our elderly citizens have access to the medical care they need, from routine checkups to life-saving surgeries. It's the reason why your grandparents can see a doctor without facing financial ruin. Then there's Medicaid, which is designed to help low-income families and individuals. It provides comprehensive coverage to millions of adults, children, pregnant women, and people with disabilities who might otherwise have no access to health care at all. For a child from a low-income household, Medicaid means they can get their vaccines, see a dentist, and get treatment for an ear infection. It's a lifeline. And let's not forget the VA healthcare system, which provides dedicated care to our nation's veterans. When you add it all up, the numbers are staggering. Over 130 million Americans, that's more than one-third of the entire country, receive their health coverage directly through a government-supported program like Medicare, Medicaid, or VA healthcare. This is a massive, life-sustaining operation that quietly runs in the background of American society, providing a level of security that is absolutely essential for tens of millions of families. It's a system that says no matter your age or income, you shouldn't be left behind. Another area where the U.S. system truly shines is in emergency and crisis response. When disaster strikes, whether it's a natural catastrophe, a terrorist attack, or a sudden medical crisis, the American healthcare system is built to respond with speed and expertise. Our emergency trauma care is among the best in the world. Level 1 trauma centers are staffed with highly trained teams ready to handle the most severe injuries imaginable, 24 hours a day. If you get into a serious car accident, this is the system that saves your life. Furthermore, federal law requires that hospital emergency rooms must treat anyone seeking treatment, regardless of their insurance status or ability to pay. This is a fundamental principle of the system. In a life or death situation, you get care, period. This extends to large-scale disaster response as well. When a hurricane hits, federal agencies coordinate with local hospitals to ensure medical supplies, personnel, and emergency services are deployed effectively. We also saw this capability during the pandemic. The government's Operation Warp Speed mobilized scientific and logistical resources to develop and distribute vaccines in record time, a monumental feat of crisis management. This capacity for rapid, high-stakes response, especially in military and veteran healthcare, demonstrates a robustness that is a core strength of the U.S. approach to health. Beyond emergencies, let's talk about the day-to-day safety and quality control that we often take for granted. The U.S. government has created a powerful regulatory framework to ensure that the medicine you take and the care you receive are safe and effective. We've already mentioned the FDA's strict drug testing, but their oversight extends much further. They are also responsible for food safety monitoring, preventing outbreaks of foodborne illnesses through rigorous inspection and regulation of the entire food supply chain. That label on your food packaging is backed by a huge system of safety checks. The government also plays a key role in hospital accreditation. Agencies like CMS set quality standards that hospitals must meet to receive funding from Medicare and Medicaid. This creates a powerful incentive for hospitals to maintain high standards of care, cleanliness, and patient safety. Medical devices, from pacemakers to artificial hips, also go through a strict regulatory process to ensure they are safe and work as intended. All of these layers of oversight and regulation work together to make American medicine among the safest and most reliable in the world. It's a system designed to build trust between patients and providers, ensuring that quality is not an accident, but a requirement. Finally, the influence of the U.S. government's health initiatives extends far beyond its own borders. The United States is a global health leader, and its policies and funding have a profound impact on health security around the world. Through programs like PEPFAR, the President's Emergency Plan for AIDS Relief, The U.S. government has invested billions of dollars to combat the HIV/AIDS epidemic in developing countries, saving millions of lives. The U.S. also funds global disease prevention programs, helping to eradicate diseases like polio and control outbreaks of Ebola and other infectious diseases before they become global pandemics. When a health crisis emerges anywhere in the world, the U.S. often plays a key role in the response, providing financial aid, expert personnel from the CDC, and logistical support. This isn't just charity. It's a smart investment in global security. In our interconnected world, a disease outbreak anywhere is a threat everywhere. By supporting and strengthening health systems in developing countries, the U.S. helps build a more resilient global community that is better prepared to face the health challenges of the future. American health policy, research, and funding are inextricably linked to the well-being of the entire planet. So while the debate over healthcare reform in the U.S. will and should continue, it's crucial to recognize the immense strengths of the existing government-managed systems. From funding the research that cures diseases, to regulating the safety of our food and medicine, to providing a healthcare safety net for over 100 million Americans, and leading the global fight against disease, the U.S. government's role in healthcare is powerful, essential, and saves countless lives every single day. Understanding this side of the story is key to having a more complete and productive conversation about the future of health in America and beyond. Thanks for watching. If you found this perspective interesting, please hit that like button, subscribe for more deep dives, and share your thoughts in the comments below.